I'm Dr. Jagadeesh PC, a senior consultant orthopedic surgeon practicing orthopedics, general orthopedics and trauma, arthroscopy and replacements, which includes the knee replacement, shoulder replacement as well as the hip replacement, and specialized in arthroscopy and sports medicine. So generally people think about when the total knee replacement they've undergone, it will be very painful and they cannot maintain their day-to-day activities for a prolonged period. But it's a myth. If a properly done knee replacement can sustain with the pain, for at least for a minimum 1 week to 2 weeks, and this gradually will come down over a period of time by proper medication and physiotherapy. So they should be able to do their normal activities, walking and staircase climbing and all in a month, provided if they take a proper rehabilitation, that is a physiotherapy which maintains their knee strengthened with the muscles and flexibility. So the painful condition will be very few days, unlike the way they have got an arthritis, which will be very painful condition. This only rests for a few days, and immediately after the surgery we'll put them on injections which reduces the pain, that will be put inside to their body, into the way the operation surgery has been done. That will take care of their painkillers with the pain. So gradually, once the pain subsides, we'll put them on oral medications that reduces the pain in overall. And also we'll give a cryotherapy, that's we'll put in icepacks over the operated side, which much more help in reducing the pain.